Good morning, everyone. It's Dr. Hodges, and it's just one more get ready with me in the morning because I wanted to get this in and I'm off to work. I had a couple of patients that I was seeing on my new patient day, and a common question came up, and that's what I wanted to discuss today. So, there is misconception about surgery in terms of who's actually a good candidate. And let's first kind of go back to see how we even define obesity. I think the first thing to know is that obesity is a disease, and it was named a disease by the NIH, oh my gosh, over 8 years ago. What's interesting though is in 1991, mind you, I just turned 50 and I graduated high school in 93. In 1991, the NIH got together and they made recommendations as to who is a good candidate for surgery. And these are the recommendations that have been used by insurance since 1991. Okay. So what their recommendation was, it was based on BMI, which I think is appropriate. And the recommendation was if you have a BMI over 35 with a health problem such as high blood pressure, diabetes, sleep apnea, osteoarthritis, if you have a comorbidity or disease that is obesity related, then you're a candidate for surgery. Or if you have a BMI over 40, then you don't even need a comorbidity. And so since that time, that is the standard that insurance companies have gone by, and by default, most bariatric surgeons and facilities, that is the standard that they go by. And even within ASMBS, and whenever you are going to a center of excellence, that is a cutoff as well. But I will say it can be site specific because each site that is a center of excellence, they have their criteria for patients as well, depending upon their designation. But that was a general rule of thumb. They did not give any recommendation as to which surgery would be better for which weight. Then, finally, in 2022, so almost 30 years later, ASMBS and IFSO, so that is the international group, they got together and had a consensus statement. They looked at all the data over the last 30 years, and they essentially determined that once you have a BMI over 30, or once your BMI is over 27.8, if you are Asian, then you're a candidate for surgery. And then they began to say, well, like if you've tried to lose weight, if you've had surgery and it failed, if you have diabetes, if you don't. But basically, in a nutshell, it is if you have, regardless of your comorbidity, because we usually have to show that patients have tried to lose weight in the past before they have surgery. And let's be honest, if you're coming to see me, it's not because you haven't ever tried to lose weight. But essentially, if you have a BMI over 30 or a BMI over 27.5, if you are Asian, you are now a candidate for surgery. Now, does that mean that all insurance companies follow those brand new guidelines? And I say brand new, they are now going on, they're 3.5 years old? No, there's only one program for sure, that is Lantern, that is following the proper guidelines. And slowly but surely, the other insurance companies are making some concessions. Some might say, well, you can have a BMI of 32, but you have to make sure you have a health problem. It's kind of like runs the gamut. And so it can be a little tricky if you were relying on insurance, depending on your BMI and if an insurance company deems you low BMI. But in my practice, if I follow the new ASMBS guidelines, and our Center of Excellence also follows those guidelines. Now, so that is, are you just a candidate for surgery? Once you check that box, you then have, what is the surgery that is best for you? Like, does it need to be stratified? Like, is one surgery better for a different weight? And I'll have patients that will come in and they kind of think, oh, well, I thought that you really needed to have, for instance, a bypass. You're only a candidate for that once you have a BMI of X. And that is incorrect. Once you are a candidate for surgery, you are a good candidate for a sleeve, bypass, duodenal switch, or if you need a revision. So it's not really weight-based. Whenever I have a consultation, I will look at patients' health problems. I will look at past surgical history, and then I will make a medical determination for them. And then I try to marry that recommendation with my patient's comfort level, because the reality is that if I have a patient who's all their family and friends have had, let's say, a sleeve, but their BMI is 68, I can tell them that even if you lose the full 65% of your excess body weight, so meaning even if the sleeve does everything it can for you, generally if your BMI is over 50, you will still be morbidly obese, like in a year's time, if you're relying slowly on the surgery, because you simply haven't gotten an aggressive enough surgery. It does not mean that you failed or your surgeon failed. It just means that you were underdosed, essentially. But sometimes something is better than nothing. And if you have a very high BMI, sometimes that's the only surgery you can have. Sometimes that's the only surgery you feel comfortable with. And again, something's better than nothing. And if we can get a good 100 pounds off you, then that is what we need to do. And so in the end, the take-home message is this. If your BMI is over 30, go with surgery. Also, when you come in and you're researching all the surgeries, really look at what your nutritional goals are and what your weight loss goals are. A lot of people in their mind, they're like, well, I just need to lose 30 pounds. If your BMI is over 35, I can guarantee you, you probably need to lose at least double that. But our mind, especially in the South, it's very skewed as to how much weight, like what's a normal appearing weight. And the reality is too, is if you have been overweight for all of your life, it can be very difficult for you to imagine yourself in Wonderland. That's like what my patients call whenever they finally get into the hundreds. So they hit like 199. They're like, I'm in Wonderland. And I love that for them. So awesome. So awesome. And I want everybody in Wonderland. I will also tell my patients, and if you've had a consult with me, you will know that if when you're coming to see me, I will always say, I am not trying to get you into Sports Illustrated. I just want you to get a good, healthy BMI, and I'm trying to get you to a BMI less than 30. Once your BMI is over 30, that is when the big decreases in overall life expectancy begin to occur. That is whenever you have a much higher risk for developing heart disease, high blood pressure, diabetes, if you don't already have those. So I'm really just trying to get you healthier, okay? Not down to a specific size. So I hope that this helps. Just know, do your research. You can go to my website. I have tons of videos. I also recommend get the most aggressive surgery that you feel comfortable with. 9 times out of 10, if your BMI is less than 50, I'll usually recommend a bypass over a sleeve. But that's, but I always discuss everything with my patients. And then if your BMI is 50 or more, then I recommend a bypass or a switch. But that's a rule of thumb. I always will have a discussion with my patients about their health history and their surgical history before we determine what's the best surgery for them. All right, does that help? So go out there and make it happen.